Tackling men's health issues. Heart disease. Heart disease is one of the leading health risks facing men today. According to the American Heart Association, more than 1 in 3 adult men has heart disease. Heart disease is an umbrella term that includes heart failure, coronary artery disease, arrhythmias, angina, and other heart-related infections, irregularities, and birth defects. Heart disease is the #1 cause of death in the world and the leading cause of death in the United States, killing over 370,000 Americans a year. Someone in the U.S. has a stroke about once every 40 seconds. Early warning signs. Difficulty catching your breath after moderate physical exertion, like walking up a flight of stairs. A sense of discomfort or squeezing in your chest that lasts for 30 minutes to a few hours. Unexplained pain in your upper torso, neck, or jaw. And heartbeat that is faster or slower than usual. Dizziness or fainting. Chest pain. Shortness of breath. Changes in your extremities such as pain, swelling, tingling, numbness, coldness, and weakness. Extreme fatigue. Irregular heartbeat. Risk factors: smoking, overweight or obesity, high blood pressure, high cholesterol, lack of physical activities, and diabetes. Preventative measures: healthy eating, exercise, maintaining a healthy weight, no smoking, and limited alcohol use. Lung cancer. Lung cancer, both small cell and non-small cell, is the second most common cancer in both men and women, not counting skin cancer. In men, prostate cancer is more common, while in women, breast cancer is more common. About 14% of all new cancers are lung cancers. About 224,390 new cases of lung cancer, about 158,080 deaths from lung cancer, and overall, the chance that a man will develop lung cancer in his lifetime is about 1 in 14. For a woman, the risk is about 1 in 17. These numbers include both smokers and non-smokers. Cigarette smoking is the #1 risk factor for lung cancer. In the United States, cigarette smoking is linked to about 80 to 90% of lung cancers. Early warning signs: a cough that won't quit, breathing changes, shortness of breath or easily winded, pain in chest area, wheezing, change in voice, unexplained weight loss. Risk factors: has a 30-pack year or more smoking history and currently smokes, ages 55 to 80, secondhand smoke, radon exposure, personal or family history of lung cancer, and diet. Preventative measures: no smoking or secondhand smoke exposure, healthy diet and exercise, limit alcohol use, watch out for chemicals. Colon cancer. Colorectal cancer is the 3rd leading cause of cancer-related deaths in the United States when men and women are considered separately, and the 2nd leading cause when both sexes are combined. It is expected to cause about 49,190 deaths during 2017. 136,119 people in the United States were diagnosed with colorectal cancer, including 71,099 men and 65,020 women. 51,813 people in the United States died from colorectal cancer, including 27,230 men and 24,583 women. Early warning signs: bloody stool, rectal bleeding, abdominal pain, unexplained persistent diarrhea, trouble passing stool, or changes in stool. Risk factors: overweight, sedentary, poor diet, age, gender, personal or family history, and polyps. Preventative measures: healthy diet and weight, regular colonoscopies, not smoking, and physical activity. Prostate cancer. Prostate cancer is the most common cancer among men except for skin cancer. This year, an estimated 180,890 men in the United States will be diagnosed with prostate cancer. For unknown reasons, the risk of prostate cancer is 70% higher in African Americans than in non-Hispanic whites. The 5-year survival rate for most men and prostate cancer is 99%. 98% are alive after 10 years, and 95% live for at least 15 years. For men diagnosed with prostate cancer that has spread to other parts of the body, the 5-year survival rate drops to 28%. Prostate cancer is the 2nd leading cause of cancer death in men in the United States. It is estimated that 26,120 deaths from this disease will occur this year. Early warning signs: Frequency, urinating much more often than normal. Urgency, having a sensation that you need to urinate immediately. Nocturia, getting up to urinate multiple times during the night. Hesitancy, difficulty starting the urine stream. Blood in the urine, blood in the semen, new onset erectile dysfunction, bone pain, especially in the lower back, hips, or ribs, and loss of bladder control. Risk factors: race, age, genetics, diet, high testosterone levels, genome changes such as BRCA1 and BRCA2. Preventative measures: healthy diet and exercise, getting enough good fat from omega-3s, no smoking, limiting stress, keep good cholesterol levels, and blood pressure. Depression and suicide. Over 41,000 people die by suicide each year in the U.S., and suicide is the 7th leading cause of death for all U.S. men, according to the National Center for Injury Prevention and Control. Suicide is the biggest killer of men between 20 and 49, eclipsing road accidents, cancer, and coronary heart disease. If you look at how the suicide rates have changed, how they go up and down, you can see that it's cultural. It's about what we expect, and this is what is so troubling about male suicide. Women are actually more likely to suffer from depression, but more likely to seek help when they encounter trouble. The uncomfortable truth is that stereotypical forms of masculinity, stiff upper lips, or laddishness are killing men. Early warning signs: fatigue, anxiety, negative talk, or threatening actions. Risk factors: feeling hopeless or isolated, family history of mental disorders, have a substance abuse problem, stressful life event, suffering from depression. Preventative measures: depression and suicide cannot be completely preventable, but there are measures you can take to decrease the chances. Talk to someone if you are having depressing or negative thoughts. Don't keep these feelings bottled up. Talk to a doctor to see if you suffer from a mental condition and can be prescribed medicine to help. Try meditation or relaxation techniques. Pick up a hobby or activity that makes you happy. Type 1 diabetes. Diabetes is a chronic, long-lasting disease that affects how your body turns food into energy. About 5% of the people who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. Early warning signs: high or low blood pressure, extreme thirst, frequent urination, slow healing cuts or sores. Managing your diabetes: lifelong insulin therapy. Most require 2 or more injections of insulin daily, with doses adjusted on the basis of self-monitoring of blood glucose levels. Long-term management requires a multidisciplinary approach that includes physicians, nurses, dietitians, and selected specialists. Balanced diet and exercise. Type 2 diabetes. Type 2 diabetes accounts for about 90 to 95% of all diagnosed cases of diabetes. The remainder are adult onset or adult diagnosed type 1 diabetes. 29.1 million people in the United States have diabetes, 8.1 million of whom may be undiagnosed and unaware of their condition. In adults 20 and older, more than 1 in every 10 people suffers from diabetes, and in seniors 65 and older, that figure rises to more than 1 in 4. Men are at a slightly higher risk of developing diabetes than women, but age, excess weight, particularly around the waist, family history, physical inactivity, and poor diet are also significant risk factors for the illness. Early warning signs: unquenchable thirst, frequent urinations, extreme hunger, fatigue, blurred vision. Risk factors: inactivity, poor diet, family history, high blood pressure, abnormal cholesterol. Preventative measures: healthy diet, regular exercise, getting cholesterol and blood pressure checked regularly, limit alcohol use, and no smoking. Erectile dysfunction. Erectile dysfunction affects about 50% of men aged 40 and over. ED is often one of the earliest warning signs of other underlying health conditions that can be quite serious. One of the most common underlying health conditions is diabetes. Erection problems can also be a symptom of heart problems such as hypertension or atherosclerosis, as well as hormone imbalances and neurological disorders such as Parkinson's disease. Preventative measures. Work with your doctor to manage diabetes, heart disease, or other chronic health conditions. See your doctor for more regular checkups and medical screening tests. Stop smoking, limit or avoid alcohol, and don't use illegal drugs. Exercise regularly, take steps to reduce stress, and get help for anxiety, depression, or other mental health concerns.